Hi, good afternoon, everyone. My name is Aubrey Vance Tovry. I'm a licensed clinical social worker and the project director for Project LifeLine program, which is a program of Siyan Clinical Research. Thank you so much for joining our team today to support the launch of our new program. This is a significant day for us to have our community join together on this platform. We have with us today doctors, directors, social workers, therapists, family members, nurses, and many others coming together. Hi, good afternoon, everyone. Of the coronavirus My name is Aubrey Vance Tovry. I'm a licensed clinical social worker and the project director for Project LifeLine program. Okay, bear with us as we get these technical difficulties figured out. Okay, so by the end of our open house, we hope that you understand the impact of COVID on mental health. We hope that you get to learn about the best coping strategies for pandemic fatigue and stress. We hope that you'll understand the scope of Siyan Clinical Research's new program, Project LifeLine, and be able to compare best practice in suicide prevention. Today, you'll get to hear from Siyan Clinical CEO, Dr. Anish Shah, myself, and Project LifeLine psychotherapist, Carrie Canine. So I would like to introduce our first presenter, Dr. Anish Shah. Dr. Shah opened Siyan Clinical Corporation in 2012 with a passion for helping our community and has continued to do so over the years through research, education, and ongoing support through the wildfires. He has extensive experience in the field, including serving as medical director at Napa State Hospital and as a general psychiatrist for Lake County Mental Health, Kaiser Permanente, and Sonoma County Mental Health. So please enjoy this talk by Dr. Shah.
This is to move forward. Okay. Thank you for the introduction, Aubrey. As you know, the COVID-19 pandemic has been forefront in all the issues we have experienced in 2020. Today, we'll talk about in my presentation, about the mental health impact of COVID-19 pandemic. 2020 has been a journey for us in many respects. And with COVID-19 pandemic hitting us hard somewhere in February, March, few of the things we anticipated what would occur. We also didn't anticipate this pandemic to be what it has turned at this time. So I'm also going to discuss about that aspects. We'll also talk about pandemic fatigue and the stress management, and also the treatment aspects and the mindset moving forward. In my last presentation, I'm very excited. Last part of my presentation, I'm very excited about the vaccines and what the future lies for us. And I'll also talk about that element at the end of this presentation. As you all know, it hit us hard in March, and there were some studies done early on in this pandemic. And we found that the stress level was significantly high. And these are the data in month of May and June. And we found that the stress amongst the parents were higher than how it was in 2019. We also found there are additional stressor that has been added about getting coronavirus, government response to coronavirus, disrupted routines. Economy has been one of the main forestay in terms of stressor when we did survey in May 2020. 70% people were concerned about the economy as compared to the last year's data where there were not as many people. Work stressor were also started to spike somewhere in May and June. So the stress has been continuously spiking since April and May, and the slide that you are seeing are the initial data of stressor in our community. Now, So, so the next, I'm sorry. Okay, yeah. So the next part is about stressor, and if you look at the data, it has been across the board uh, almost similar. You see the United States map here. It has been same across the party line and also across the geographical line. Even people with their political belief, Democrats, Republican, Independents, they all have experienced stress through COVID-19 pandemic. And this is the slide that depicts and shows that. Obviously, stress has been a higher element in community of color. It has impacted Hispanics the most. Partly one can assume because they are also impacted most with COVID-19 pandemic and infections. But community of color generally have had a higher stress through this pandemic compared to other subpopulations um, and so forth. Um, Now, I also want to talk about scientific aspect of COVID-related stress. What does stress generally do to us? Stress actually is a normal part of human experience, the life we live, and the experience we have. Stress is normal. We all experience that, and sometimes stress can be positive. When we are stressed, we are more focused, we have more energy to get things done, and we are also able to accomplish more for the short time. And when the stress goes down, we are kind of reverting to our normal routines. um, and stress generally have many sources. It could be social, political, health related issues. If you are undergoing some surgical procedures or a health related impact that spikes our stress, lot of time stress comes from misinformation or cognitive distortion that we call, meaning that our own belief system about how things are happening around us can also cause stress. um, like I said, stress can be positive, but at the same time, when it becomes chronic, it impacts in many body systems. It impacts and makes some physiological changes in our various metabolic, endocrinological, and other systems, and creates specific sets of symptoms to us. For example, our cortisol, adrenaline, noradrenaline gets spiked, and as a result, we might feel more nervous. We have fight or flight response. Our breathing starts to become laborious. So, that is how it affects the respiratory system. And sometimes with increased stress, people with asthma has difficulty in managing their oxygen saturations. It also dumps our immune response. It affects our immune response because it increases cortisol. And as a result, we may be more prone to various infections. In musculoskeletal system, it kind of starts to brace, muscle bracing, which we call as, causing muscle contractions. And as a result, one can develop chronic pain as a result of stress. In cardiovascular system, it causes tachycardia, hypertension, and it has increased incidences. People with stress, chronic stress has increased incidences of having cardiovascular death as well as stroke. In GI system, one can experience heartburns, peptic ulcer disease, uh, reproductive systems, infertility incidences are high with chronic stress. Also, it decreases your testosterone level, so the man can experience impotence or sexual dysfunctions because of the stress. Clearly, stress affects emotional well-being. With stress, we encounter more depression, anxiety, and then when we have uh, inappropriate coping skills, poor coping skills, it can sometimes lead to spike in alcohol and drug related incidences or issues. So stress has many uh, issues in multiple domains. So I always say, learn to manage your stress before it manages you. That's my mantra. uh, I want to now talk a little bit about pandemic fatigue. Maybe not what you think, um, but pandemic fatigue is a state of being worn and worn out because of the recommendation and precautions related to pandemic, thereby leading to abandoning these precautions and risk catching the disease. So it's kind of a fatigue being abiding what we have been asked to do it. And it is a unique situation one experiences when they have pandemic, when they are in a chronic pandemic uh, living situation, psychosocially, that we all experience. And I think it's good to be cognizant about pandemic fatigue so we know what to do and how to take care of our issues. So, like I said, pandemic fatigue is sort of an exhaustion stemming from the effect of COVID-19 on our lives. And this year, we had lot of etiologies that explains why we are hitting to pandemic fatigue at this time. There is a persistent state of high alert. We have elevated stress hormones now for a long time, almost 7 to 8 months. We have had cognitive fatigue, thinking, figuring out a lot of the different normal social norms and expectations in current pandemic. And that is also combined with a lot of uncertainties that we face in our day-to-day life. What's going to happen? What's the future lies for us? That causes cognitive fatigue and in turn causes pandemic fatigue. A sense that what lies ahead may be overwhelming. The virus behavior itself, the case is going up, case is changing, the viral behavior affecting differently in various subpopulations. That also is an overwhelming experience that we all are feeling. Stay at home orders, homeschooling, working from home, being isolated is also a contributory factors. And then we never had this before, so we all lack strategies to survive and adapt to the new normal. And I think that's a big part why we feel pandemic fatigue at this time. And disruption of routine, as you all know, we have a new routines, new norms, and the constant fear of getting COVID-19 to one and one's family is another major etiological factor, much or risk factors that contributes to the pandemic fatigue. Financial issues, loss of income for your or loved one, and also it can be actual or feared, because we don't know what future lies ahead of us in terms of economic certainties for all of us. So these are the various things that contributes into pandemic fatigue. Now, when we have pandemic fatigue, what do we experience? We experience fear, we experience anxiety, we experience loneliness, and we experience hopelessness. And then that is also mixed with lot of cognitive distortion in a late term, if I describe, not is not seeing things as they are. So one's ability to look through shades of gray is impacted when we have cognitive distortions. So this is what usually pandemic fatigue brings into us. Main signs, if you look at psychological domain, feeling sad, helpless, worried, our eating and sleeping change pattern starts to change with pandemic fatigue. We have trouble focusing, racing thoughts which are sort of persistent. uh, we start withdrawing from others. We start snapping, arguing with others, and we have less motivations when we are experiencing pandemic fatigue. Uh, Once again, there are 7 ways to cope with pandemic fatigue that I would like to go over, which may be very helpful just generally to have a cognizant, the uh, have the sight of it while we are experiencing these symptoms. First is the physical health, diet, nutrition, sleep, and exercise. Those 4 domains. If you wash like hawk, it really helps get through this difficult time. Again, when it's physical health, just normal diet, nutrition, sleep, and daily exercise. Limit your news intake, no more than 1 hour, and only choose information from a reputable source. Disinformation, wrong information, misinformation is a major source of stress as we go and combat this pandemic. Lower your stress. I would say uh, do something which you are enjoying. So these are the various things that comedy, nature, any joy producing activities that you can safely do it. Try to pay some extra attentions to schedule this time in your day-to-day routine through the pandemic that we are in right now in our day-to-day routines. Connect with others, online, or some discussion group would be good. Send notes, have a gratitude journal. I think those are very, very useful interventions. And one of the most important thing, when you feel down or anxious through this, name and accept your feelings. Identify what it is that you're feeling right now, write it down, and focus on developing strategies um, to accept and then do something about it. I would say replace your negative thoughts by focusing on positive. For example, if you're worried about getting COVID, then make a list of things that you do to stay safe. So take an actions, write your worries down, and then and write a strategy to deal with it. Uh, and then add, if you add new practices and traditions, hobbies, skills, family night, playing a board games that you haven't played for a long time, something you can do safely through the pandemic. So adding something new what you haven't done is also very helpful. Through this pandemic, I just want to go through a journey of what has really occurred. Things have changed. Oh, and then I want to see what we have learned. We have learned to be Zoom meetings or audio-visual meetings have become a normal norms. Distance learning, conducting businesses with distance, uh, communications using various audio-visual medium. Strong We have also seen there is a strong resistance that has evolved normal norms through medical professions recommendation, and there is a very clear disparity that we have noted to curb pandemic uh, between the leadership and the medical profession. So that's what we have also learned and observed. There has been unparalleled stress that has grown through this pandemic, as I've said, and then at the same time we have also seen some evolving resistance. The possibility of pushing it forward and new ways of meeting, new ways of appreciating our health, and increased compassion. So there is also some positivity that has evolved through this pandemic at this time. And what we didn't expect is that this pandemic is going to be so long. We didn't expect this in March, that we are going to be in December and we are still be experiencing spike in number of cases. So this is not what we expected when we started to get into it. The extent of confusion and incompetence from national leadership is not what we expected. And mistrust of professional scientific information or refusal of those recommendations was other aspects that we didn't expect going through this pandemic. Once again, I want to summarize my seven skills that I have said to watch out: physical health, limiting news, social media and disinformation, stress reducing exercise, connecting with others, accepting your feeling, focusing on your positive, and new practices and activities every day. Sleep hygiene is critical. I think one should really closely monitor that part. Having a consistency is the first point. Having a same rising time daily, even during weekdays, weekends, or during vacation, you should have a same wake up time that really help you set your brain to a regular sleep rhythm. Limiting nap no more than one a day, 30 minutes max, 7 hours of sleep, planning that, not going to bed unless you are sleepy, or 20 minutes before you go to bed, and use your bed only for two things: for sleep and sex, and not lay around, read books, or do anything when you go to bed. I would also just say, do not exercise or take alcohol before bedtime, even if you feel that alcohol will help you relax. It's really not a good idea to drink before you go to bed. Uh, and then there are few other tips. I won't go into details, but I have a PDF I'm happy to share it with the group if there is enough interest. But watching and observing your sleep hygiene is very critical. And then this question is something we get asked all the time: when to seek professional psychiatric help? Isn't this a new normal? Should we just push through it? So I think it's good to have a sight of certain criteria to monitor amongst yourself or your family to see this is a time for us now to seek a professional help. If you have a pervasive depression more than 3 weeks, I think you should look for it. If you have a severe anxiety with panic attacks, if you are continue issue with sleep with less than 4 hours and you're not sleeping for several days, that's the time to seek help. Um, Suicidal thoughts are never normal. When you have suicidal thought or your loved one have a suicidal thought, seek out and help. Problem with your memory, concentration, procrastinations, and if it's prolonged more than 3 or 4, and if you feel you're not, if this is more than your baseline, please uh, take a proactive action. Excessive alcohol use, more than one for women or two for men, or any illicit substance is also not normal coping. And if you are ever experiencing any psychotic symptoms like altered hallucination, feeling paranoid, and then obsessive or compulsive behavior, that's the time also to seek professional help. So these are some of the broad criteria that I have come up to so we can monitor about when to seek help. So vaccine is, at the end, I just want to talk a little bit about the vaccine aspects, and I'm really personally very excited about the vaccine, and then there are reasons for us to get excited about it. It's an important task. It's important goal that we have to have majority of our subpopulation vaccinated in next few months. That is the only one of the most significant way to curb this pandemic and achieve herd immunity. Um, and I'm really looking forward myself to contribute to this cause. And I would urge other leadership to also participating in pursuing general patient population, uh, and also working through the challenges of getting vaccines to majority of us. So the vaccine is a very important piece moving forward. And I just want to talk about different type of vaccines which are in works and how they work. So there are four broad categories of vaccine: nucleic acid vaccine, inactivated vaccine, vector vaccines, and the protein vaccine. And they all have a different component into it. So it's the way they are manufactured are very differently. So for example, in nucleic acid vaccine, a fragment of messenger RNA or DNA is inserted into making copies of targeted antigen. So this is a new technology, and Pfizer and Moderna, they both have this technology in their vaccine productions, and it elicits antibody and cytokine T cells response. So which is the helpful response that we want to see after administering, and there is a one booster dose that is required. So actually you need to take 2 injections to get the adequate immunity which they claim to be. And it has 90 to 95% efficacy. And like I said, Moderna, Pfizer, Inovio, and CureVac is in works. And we all are looking forward for Pfizer's news tomorrow when it's going through the FDA, and probably will have a green signal tomorrow. So that's the nucleic acid vaccine. Inactivated viral vaccine is generally when we are using kill virus version of the virus to generate the immunity. It sort of elicit the neutralizing antibody response, but it doesn't cause cell mediated response. So it doesn't cause the T cell response that we are looking to generate. Generally, inactivated vaccines are very safe in immunocompromised patient, and a lot of the Chinese researchers are working on this vaccine. And last two are viral vectors, where we are using modified non-coronavirus. So we are using other viruses and their spike proteins to evoke antibody response, and also cytokines T cells response. Um, they say safety is somewhat concerning in immunocompromised patient in initial data. I'm hoping it will be all fine when the full all studies are done and it's been actually administered. Johnson and AstraZeneca has this vaccine. And in terms of protein vaccines, recombinant viral proteins that we are using to elicit immune response. And it also is a proven technology already in use in many of the other vaccines that we are using. And Sanofi Novavax are working on it, and they currently do not have a vaccine that is going through an final approval process through FDA. We hope to see these vaccines sometime in near future also. Now what? My suggestion to all is follow best practice for COVID avoidance. Seek help when effects are pervasive, depression, anxiety, and some of the criteria that I discussed. Emphasize patience, but also empathize with self-care, and also cultivating your inner resources and focusing on today, living in presence is very important, and also having a positive mindset. Lastly, I want to say we all are also contributing here at Siyan to the large body of knowledge about impact of COVID-19 on mental health issues. We are serving patient population with pre-existing psychiatric issues. We are serving about 500 patients and we are using epidemic pandemic inventory tool, and we are collecting this data to measure the psychosocial impact of COVID-19. And then we are going to look into the long-term effects of what it has done to us systematically. And this is our local Sonoma County projects. So we are really excited about this. I want to thank you, everyone. And I would take questions at the end. Thank you, Obi. Okay, you go.
Thank you so much, Dr. Shah, for that information about how stress shows up during the pandemic, especially during this point where we're all feeling this fatigue. I know that I always learn something new from you, but it was especially important to learn about those vaccines. I don't know much about them, and so thank you for that. So before I get started with talking about Project LifeLine, our new program, I want to give you all an overview as to why the grant opportunity was created. And I know Dr. Shah talked already a little bit about this, so there may be some overlap or maybe some new data that you get to hear today. So a few months after the start of COVID-19, the CDC conducted a survey among adults 18 and older to assess the rise in mental health and substance use due to COVID. The survey confirmed what SAMHSA predicted and what I'll speak to more later in this presentation, and that is that 40.9% of adults reported struggling with at least one mental health condition. The survey was conducted in June of this year. Therefore, the percentage is probably over 50% at this point, since we're about 6 months out from that. Here you see another graph from data collected by the Kaiser Family Foundation that shows us the rise in anxiety, depression from May, June, and July. The categories list anxiety, depression, and then a combination of anxiety and depression, which each category showing a steady rise in the percentage of symptoms due to COVID. So you can see that last one in July, 40.1%, which is pretty on point with the CDC's data as well. So in order to keep us safe from COVID, we have been required to stay at home and physically distance from people outside our home. However, this safety measure has caused unintended consequences for at-risk populations. We are seeing a considerably higher rate of suicide ideation and substance use. Some of the most vulnerable populations who seriously considered suicide 30 days prior to taking the CDC survey are transitional age youth. Those are the folks who are ages 18 to 24. Other groups are minority racial groups, specifically the Latinx and Black communities, essential workers, and the highest percentage group who was seriously considered suicide was self-reported unpaid caregiver adults. The other group we should take special consideration for is individuals who are victims of domestic violence. According to Dr. Jackie Campbell from Johns Hopkins, We don't have evidence that there is a rise in domestic violence. In fact, a lot of areas are seeing about a 50% decrease in domestic violence people accessing their services. But what they did notice is that there is an increase in murder-suicide from this time last year. So for those of you who don't know, this is when a male partner kills a female partner and then kills himself. So this is pretty unfortunate and definitely an unintended consequence from this pandemic. Some of the reasons why victims of domestic violence are more at risk during COVID is because financial stress due to job loss, activities and events are closed, schools are closed, and there are orders to physically distance from friends and family. All of these reasons and many more eliminate crucial exposure to support systems that could intervene and support the victim. Now that we've reviewed the data or the scope of the problem, let's talk about the implementation of Project LifeLine. In May of this year, the Substance Abuse and Mental Health Administration recognized there were already 57.8 million Americans living with mental or substance use disorders, and that suicide is the 10th leading cause of death in our nation. They predicted that the pandemic crisis would contribute to an increase in the number of Americans needing urgent care to address mental health needs, including suicidality. They recognized that people would struggle with increases in depression, anxiety, trauma, grief, isolation, loss of employment, financial instability, and other challenges, which can lead to suicide and suicide attempts. So the purpose of our program is to support communities during the COVID-19 pandemic in additional efforts to prevent suicide and suicide attempts among adults aged 25 and up, with the overall goal to reduce the suicide attempt. The length of the grant will go until November 2021. However, we expect the need for mental health services to continue to be high at that time, so we plan to sustain our program through third-party funding sources and other grant opportunities. As I mentioned in the previous slide, our overall goal is to prevent suicide in adults 25 and up. That's a pretty big goal with a lot of layers, so I'm going to give you a breakdown of what we're doing. We are providing outpatient mental health services to individuals who've been directly or indirectly impacted by COVID by using wraparound services such as psychotherapy, using evidence-based practice, or using trauma-informed care, case management, and best practice in suicide transitions. Two important aspects about the program is that 25% of enrollment will be directed to victims of domestic violence, and that we'll partner with you, the stakeholder. So we want to get referrals from you or figure out what your need might be and how we can support you. The goal is to create this system of continuity of care and really join together. So I won't go into all of the interventions that we provide to patients in the program, as Carrie, the psychotherapist, is going to talk a little bit about that later. So I'm going to give you an overview of the zero suicide model and our high aspiration to use this across our system of care. This model was created because leading experts in healthcare, in our healthcare field, recognize that the system is fragmented. We know this because research tells us that 38% of people visited a healthcare provider within the week before their suicide attempt. And an astonishing 95% of people visited their healthcare provider within the year before. So with that data in mind, between 2010 to 2013, the Zero Suicide Task Force launched the Zero Suicide Model. They identified a need for improvement in suicide prevention. There are three guiding principles within the model that are meant for all healthcare systems to adopt and to implement. The first one is our core values. What are we without our core values? This is the belief and commitment that suicide can be eliminated. We can do this by improving access to care and improving the quality of care through the constant practice of quality improvement. Second, we have systems management principles. Within this principle, we work to take steps to shift our culture to one that doesn't accept suicide as an option. If we set high-level, achievable goals, we can improve service delivery and collaborate between systems to eliminate suicide and suicide attempts. Third, we have the evidence-based practice. Most agencies already are familiar with evidence-based practice and have implemented it in some way or another. But some providers talk about how they don't feel confident using certain skills, or some of us just, it's been a while and we need to brush up. So we want to make it available. We want to make it affordable and available to everybody in the community. Project LifeLine has adopted the zero suicide model, and we're taking active steps to ensure the whole agency is trained in suicide prevention. That means everybody from our admin team to our marketing team. So people who are non-clinicians would know the warning signs for suicide and know how to assess. The zero suicide guiding principles are inspiring and motivating, but they don't tell us specifically how to implement the zero suicide model across our system of care. So the experts in the task force developed 7 components. First things first, we need leaders. We need leaders who are going to guide the movement. A leader is someone who's going to help us define the staff roles. They're going to implement policies and elicit feedback about what's working in our system and what's not. After a team is established, staff roles are established, everyone should be trained in basic assessment skills. Additional training to all clinical staff should be provided to ensure everyone has a level of skill in assessing and managing and treatment planning for patients who are at risk of suicide. The next step is to identify those who are at risk. Every single client we meet with needs to be assessed for suicide, and it doesn't matter which door they enter first. It could be the ER, it could be inpatient, outpatient, primary care. There is no wrong door when we are using the zero suicide model. So after we identify the level of risk, policies and procedures will guide our frequency and duration of services and the meeting with the patient depending on the level of care needed. Next, we'll engage the client in using the suicide management plan, or as many refer to as the safety plan. The client and their family should also be aware of this plan. We want everybody on board. So after the management plan is created, we treat the patient. Each system of care is responsible for creating standard patient education materials about expectations for specific treatment modalities. They create a process for charting patient progress with suicide-specific treatment and share progress on suicide-specific treatment with the patient. So we really want to get them involved. Then, depending on the level of care the patient needs, we support them in their transition. What this means is that as an outpatient provider, our team is going to follow the care between systems. If we have a suicidal patient, we're going to provide a warm handoff with important information to the provider, including their suicide management plan. We want releases of information. We want patient history. We want to be able to get all this information so all of us are on the same page. So lastly, we want to look at improving the process and creating a blame-free culture that can analyze policies and procedures that might have failed us. So take the blame away from the person and really look at our system and what we're using as a structure to keep us in line. And just, we've got to get away from blaming people that it's their fault. The zero suicide model collects patient data every 6 to 12 months, and that's exactly what our evaluator is going to do in our program, which communicates to us how we're doing, if people are less suicidal, if their symptoms are improving, and that guiding principle is going to tell us what we need to do next and how we can improve our interventions. The zero suicide model is aspirational, and it will take time to implement. It's not going to happen overnight. So what can we do in the meantime? We can focus and commit to continuity of care strategies together. What this looks like is establishing a relationship with other providers in the community. So that's all of us. Good communication is key to ensuring providers and family are on the same page in terms of the patient's care. And this isn't always easy to do because we have high caseloads, our paperwork is piled up, we're all exhausted from this pandemic. But I want to encourage us to open our minds and think creatively how we can better connect so we can prevent suicide from happening in our community. So I know I will be giving this a lot of thought. Feel free to share your ideas with us. If you have any questions about it, type it in the chat box. Ideas, questions, everything is welcome, because I think that it's going to take a conversation before we can really get to the goal of what we want. So before I hand it over to Carrie, I want to leave you with this quote. I saw this and thought, wow, I'm lucky to be a part of a community that is so strong. I moved here last November from San Diego, and it felt so fragmented. San Diego is a beautiful place, don't get me wrong. But when I came to Sonoma County and I interviewed here, I just knew right away that this was a place for me. Despite the challenges with the wildfires, just risk of earthquakes and everything else here, I felt immediately like I belonged and that this community really does already work together. So I just want us to walk away with this. People working together in a strong community with a shared goal and a common purpose can make the impossible possible. Now, I'd like to introduce Project LifeLine psychotherapist, Carrie Canine. Carrie is a licensed marriage and family therapist with over 5 years of experience in suicide intervention and prevention. She brings training and expertise gained by working in various crisis support roles, including the mobile support team and the crisis stabilization unit. Carrie uses a positive psychology approach to focus on the client's strengths and values, and she has been a delightful addition to our team. So without further ado, here is Carrie. For next.
Okay. Hi, everybody. Those two are a real tough act to follow, but I'm really happy to be here, and I'm happy that you're here with me. So I sort of building on what Aubrey and Dr. Shaw have already said, is that when we talk about a treatment team here at Project LifeLine, we are really talking about all of us as a treatment team, that we all are bigger than the sum of our parts. And in establishing this program in Sonoma County, what we're really trying to do or hoping to do is to build on the strengths that you guys have already established and add in services where we can. So like inviting therapists who need counseling, like maybe you're not able to get it because your provider isn't doing services, we certainly have bandwidth to do that. As part of the program, we're all getting extensive training in trauma and domestic violence. We're all, as Aubrey said, getting our skills brushed up on the usual things, and also including new things. I think that's one of the great things about working at Siyan Clinical is that in addition to DBT and CBT, we are able to incorporate some of the cutting edge theories in psychology. And so our program aims to create that 360 view. We want to be able to share information with you and have you share information with us for those patients that often get missed in our community because they're frequent users of the services. Maybe they're exhausting the resources that you're in your program, and you're sort of at an end at what you can provide. And so that's a time when you could reach out to us to see if there are other things that we can provide that maybe your agency cannot. And so we offer a wide range of services, including access to really top-notch psychiatrists who are already working in these crisis support roles. Our program is definitely not one size fits all, though to some extent the components are the same. We offer an intake 2 business days from referral. Our appointments for the most part right now are in Zoom. We're anticipating yet another sort of formal shutdown, but we have also been doing in-person appointments. Our staff gets tested every 2 weeks for COVID-19, and of course we have the usual screening process at the front door. As part of our intake assessment, we use pretty standardized tools, the PHQ-9, the GAD-7, the SSRS, and the Danger tool. In addition to that, we use a SAMHSA assessment tool that helps gather demographic information that helps us analyze our population sort of across time. I work with Aubrey to develop treatment plans and safety plans for the clients that come in based on their level of acuity according to these assessment tools. And then in addition, I've been layering in positive psychology, neuropsychology, internal family systems, as ways to give clients sort of meaning and purpose. Because what I've sort of learned over time is that DBT and CBT only go so far. But what's missing most, especially in this pandemic, is meaning and purpose. If you're not a student anymore, you have to be at home living with your parents. If you're not going into work anymore, your sense of self and what's important is really getting lost. And that's the very thing that we need to augment in our patients. And so also at Siyan Clinical, I mean, in addition to having access to our psychiatrists, our case manager can help link patients to your support services in the community. And we have access to like medically assisted treatment here for those people who maybe have their substance use has, as Dr. Shah said, become more acute in the last few months. So there are a number of programs here just at Siyan Clinical that may be able to augment those services that you're already providing. I have sort of of course, we work with trauma-informed care stone of sorts that help patients unlock, why is it that I go from 0 to 100 every time I feel like my a partner has abandoned me when I try and talk about how scared I am about COVID-19? How come it is I think about cutting myself every time I feel lonely? And so for all of our patients, sad, mad, scared, lonely, there's usually one of those that they tolerate less well. There's usually one of those that leads reliably to the maladaptive response that is harmful, whether that's substance or conflict or cutting, other things, suicide attempts. That I found that this negative core beliefs, it just unlocks so much information. It's a way for patients to really get, why do I need to use DBT? It's because every time this trigger happens, you have this response and it's completely out of proportion to the situation. So I've worked in a number of environments in the past, and it's been really hard to have patients be able to see what those negative core beliefs are doing in their lives and really kind of grasp it. And I feel like this tool has been a really great sort of addition to our tool belt to work with patients. Treatment interventions. I think I picked the slides on the superheroes because part of what I want to do and what we want to do is empower the patients or make them feel, again, like they have some control or choice over their lives, because the last 8 months, people have felt like any choice that they have has sort of been pulled away. And so, as Dr. Shah said, a lot of what we're doing is retraining people's brain. It's the neuropsychology of helping them find the things that are going right. And that's especially important right now because there are things going right. It's just that when we're anxious, when we're depressed, our brains become Teflon for good and Velcro for bad. And so it's helping people's brains become more sticky for the things that are going right. And so the interventions, I don't want to go too far into defining what is CBT or what is DBT, because I'm assuming this audience is already pretty familiar with those tools. But of course, like first and foremost, we do the assessments and develop with the patient a collaborative treatment plan. We do DBT to challenge those emotions sort of that create those maladaptive responses. We use CBT to challenge the negative core beliefs and also the cognitive distortions that Dr. Shah already spoke to. Though for our patients now, sort of what I'm seeing is for those people who had, before sort of lower scores in the PHQ-9 or the GAD-7, their scores are higher, their acuity is higher. And certainly if you've been reading, say in our area, the Press Democrat, even hospitals like Aurora have been saying that it's not necessarily, and also CSU, the census counts aren't necessarily higher, but it's the acuity that's higher. The patients are more symptomatic, they're more severely symptomatic, they have violence to themselves or others. And so I might spend a little time on positive psychology because it's a newer it's a newer philosophy, but it's a focus on what's going right. And the way that we do that is we help the patient develop gratitude. We start kind of small with thankful, or even things that made you smile, because when you're super suffering with depression and anxiety, gratitude is a huge word to take on. But it's like a gratitude journal at the end of the day, 3 things that made me smile, 3 things that I'm thankful for, until they realize that they're attuning their mind until it naturally finds those things that they're grateful for each and every day. I'm grateful I'm with my family. I'm grateful I know they're safe. I'm grateful that we have money coming in. I'm grateful that there's food on our table. I'm grateful that I'm well. So there are things that we can be grateful for. It's just hard to find when we're not feeling well. The other thing we've been using, or I've been using, is a strengths assessment tool through Gallup Strengths Finder. It's a Clifton. Ed Diener, one of the guys who started positive psychology, has this company and an instrument that is used to assess patient strengths. And for those patients that I've been using that assessment tool with, they're recovering, they're bouncing back, their resilience is developing faster than those patients that I don't use the tool with. I feel like this tool is especially important for my 20-something and 30-something clients, where their lives have been completely derailed just because job opportunities or school opportunities have been completely taken off the table by COVID-19. And so for them, helping them finding meaning and purpose is especially important, because the whole neuropsychology, we don't want their brains to be creating these synapses or pathways that keep them locked into anxiety and depression if it's not a genetic predisposition that they have. So in addition to treatment plans, CBT, DBT, positive psychology, I think Aubrey spoke a little bit about transition planning, because we will always, we start these conversations with the end in mind, and sort of how are we going to prevent relapse? What kind of safety net can we help them create so that when they step out of our program, they don't feel like they're stepping out into water and they're going to drown. They feel like they're stepping out into solid ground. This is the case management services that we provide in-house. As part of the program, we brought on board a case manager who's super well networked in our community and is working a lot with our domestic violence clients. They need additional resources and supports that simple psychotherapy can't provide. And so she's been a real asset in helping getting these populations really well resourced. I'm sure she's going to be reaching out to some of you to help in this work. If you have questions for us about how we'd like that to happen, please put them in chat. But we're super grateful to have these alliances with you because they mean so much to this population. And then, of course, I just wanted you guys to know that we're also making referrals to patients and their families for resources that have been super useful in the past. So peer support groups are really important right now, just so people understand that they're not alone in it. There are other people like me who have gone through what I'm going through, and look, they're on the other side of it now. Family support groups. So families are often at a loss as to what to do when their family member goes into suicidal ideation. They don't know how to support them. They don't know what to do in a crisis. They don't know who to call. And so both NAMI and Bekaloo programs have really good peer support and family support programs. So we are definitely giving those names and those phone numbers out to those people. They have websites that already have been really useful to our patients. County of Sonoma also has peer support training. Of course, they support a lot of the Medi-Cal patients, and so we want to be sure that we stay in touch with their case managers and they understand anything that we're doing to help their patients. We do receive referrals from Verity and YWCA. We already have those referrals, so thank you so much for sending them our way. We're grateful to be working with those people. And then we do have substance abuse referrals that we make, but also a substance abuse counselor here on site who's very experienced, and a nurse practitioner who's also focused on substance use and abuse. So lots in the way of resources here. We're sort of a library that you can pull down resources when you need it to augment the services that you already have. So let me back up a little bit. So in addition to all of these things on the services, the other thing that I feel like is super important, and I think we're starting to hear it a little bit more in the political environment, is just instead of people being super polarized, that we work more closely together, that we realize that we have more in common than we do different, and that we sort of connect back into our spiritual traditions. And even though we don't espouse a certain spiritual practice here, finding a connection with one's spiritual source is super important during these times. It's another way that people find purpose and meaning, and it's another way that helps them cope. Like they belong to something larger than themselves. And that's true, either at the individual level or here at the program level, is we do believe that we belong to something larger than ourselves, and that is all of you. So I think that ends my presentation. Thank you so much for your time. I'm going to turn it back over to Aubrey.
Okay. So don't go too far, Carrie. I'm going to have you actually respond to a question here in a minute that we got in the chat box. So here you guys see a couple of dates. So save the date. Part of our grant is that we are going to be educating the community. So we're going to be putting on another PowerPoint presentation and have the topic of suicide prevention. We'll probably speak more to zero suicide, other interventions. Also, let us know what your needs are, and so that we can come up with education that's, meets the community needs. So if you want to write that in the chat box, feel free to do that, or you can send me an email, which was on the invite today. So note in your calendar, March 10th, 2021 and June 9th, 2021. And then we're going to move to questions. So if you haven't done so already, go ahead and type your question in the chat box. And then the person who can speak to that will go ahead and step in and respond. After we do questions, I know I had mentioned that we're going to be doing a raffle and prize. And so that's going to be happening after the presentation. So if you've logged in to the presentation, we took note of everybody who signed in, and I'm going to be doing a raffle, and a prize will go to 2 winners for an Uber Eats gift certificate. So keep an eye out for an email. You may be the lucky winner. All right. So first question that we have is, can we refer clients to you for DBT? And is that group work? And yes, we're going to be starting a DBT group next year. Right now, we're starting a coping skills group for parents that starts next week. We have noticed with a majority of our patients being mothers who have kids that are on Zoom, and it's just been extremely stressful. So our case manager, Karina, who's trained in Triple P, will be doing the coping skills group first, and then DBT will take place starting in January. The next question is, could you share more information on the strengths assessment? I'd love to look into it. So I'm going to have Carrie speak to that, since she has become somewhat of an expert in the strengths assessment.
Okay, thank you, Aubrey. I would love to have a conversation with you, sort of one-on-one. The strengths discussion is a little bit bigger than a bread box, but it started for me. I was really struggling to help people find meaning and purpose, because when somebody has meaning or purpose in their lives, they can endure so much more. There's a really great book out by an author who survived the concentration camps, and he did that because he wanted to get back to his wife. He was connected to his faith, and so I was doing some research into how do people find meaning and purpose. and I kept running into Clifton's Strength Finder as a tool that helps people identify their top 5 strengths. And the idea is that when you help people find their top 5 strengths and help them use their strengths consciously, they they enter this flow state. And I don't know, flow is another psychology term, but it's the kind of thing where you're doing something and all of a sudden 2 hours goes by and you lose track of time. Or it's something that you're naturally good at and it makes you super happy. It's like effortless, easy, and fun. It's just, there's something. And so helping clients find you have them take the assessments, about 45 minutes long, and then it returns a couple of reports that you help the client digest. And in the reports is sort of detailed descriptions of how you know when the strengths are in action. And so the way that I use it is more of a psychological bent probably than Clifton, is I help them see that maybe some of those strengths were developed in their family of origin based on the role that they held in their family. They might be strong suits. And that leads into a discussion that there are other strengths that they have that maybe they haven't been called on to use as much as they needed them in their family of origin. And so then the conversations evolve into, okay, let's think about what's going right in your life. Let's figure out what kinds of things make you smile, what kinds of things are effortless and easy, where are you doing things where you lose track of time? How do we get you into that flow state, that sort of infinity flow state more often, so that you're in the present moment and that you're happier? Because there's a ton of research on people being in the present moment and being happier than when they're future tripping and anxious or ruminating over the past. So really, it's another sort of tool to use to help people get in the present moment and give them hope and purpose. Is that right?
Yeah.
Okay.
Beautiful.
And I'd love to talk to you about it further if you'd like to. You can certainly Google Clifton Strengths Finder. It costs, I think, for the average person like $20 just to do the 5 strengths. And we've been allowed to purchase a block of those codes to use with our patients. I'd love to talk to you about it further.
Thank you so much, Carrie. Yeah, we've found the strengths assessment to be extremely useful. We've also used it with our team, and so we haven't quite gone over all of our results yet, but we're going to use it to enhance our team's capabilities, and it's really exciting. So if you do have a question for Carrie, feel free to email me at atofree@Siyan Clinical, and I can forward it over to her. So is there any other questions? Okay, well, it looks like we are wrapping up a bit early today. We just want to thank you so much for joining. Oh, I think we might have one more question.
The question is from Rex.
Okay.
And the question is, what are key criteria as client referrals to you?
Mm-hmm.
Criteria are primarily focused towards suicidality or DV in history.
Mm-hmm. That is a great question. And I think that is the most common question that we're getting as we're introducing our program, because it's so broad. We have this capability to take people who, you don't have to have suicidality and you don't have to have domestic violence. You can be struggling with mental health symptoms. You can have anxiety, depression, maybe some impairments. You know, I think social anxiety, we're going to start to see a lot more. It's just difficult to get out because we've been inside for so long. So the biggest criteria is that the person needs to be 25 or older. Unfortunately, even though we are seeing the transitional age youth population, that like 18 to 20, they're really struggling right now. And we've had to, unfortunately, refer a lot of them out, but we can't accept them. So 25 and up is the strictest criteria. Other than that, if you have any question at all that they could benefit from our program using case management, psychotherapy, medication management, refer them on over and we'll do an assessment. If for some reason they need a higher level of care than outpatient, we'll connect them with that. So we have those capabilities. Hopefully that answers your question, Rex. Thank you. Any other questions?
There is a question, but I did respond to it.
Okay.
It is, are you going to email us the presentation? I was not able to attend from the start. And I did respond that email provided in the chat. You will receive the link for the Facebook Live and YouTube Live.
Wonderful. So yes, everybody will have access to that.
And another question from Kelsey. How many openings do you currently have for new referrals?
So we have the ability to take up to 100 clients with possibility to exceed that. We're going to speak to our grant officer just because there is such a high need. You know, we started taking patients October 1st and we have 45 patients already. So that sort of answers your question. We have 45, we have the ability to take 100. So we definitely have space right now. And we're hoping to grow and maybe take on another therapist or continue to expand because there's definitely a need in our community. Okay, no other questions? If you do have any questions, feel free to email me. Again, that was on the invite, and then I sent everybody that email blast yesterday with the Zoom link. So feel free to reach out if you have any questions about the referral process. I am responding all day, every day. This program is my priority and to make sure that patients are getting their needs met. So I deeply appreciate all of you for joining today. Our whole team appreciates it. And we're looking forward to hosting more education events. This is sort of Siyan's specialty. So look out for more emails from us or annoying phone calls from me. Sorry if I've annoyed any of you. I just really want to connect with you and better serve our community. So take good care and have a safe holiday season.